Welcome to A2A Conversations, an ongoing discussion about turning adversity into advocacy. Join us as we explore the power of purpose, service, and empathy, and the resilience we build when helping ourselves by helping others. Now here's our host, A2A Founder Jeff Bell.
Hello, and welcome to another episode of A2A Conversations. You are in for a treat today, as my guest today is a truly remarkable woman whose story I am certain will inspire you. Her name is Ann Graham, and she is the founder of MIB Agents, a nonprofit serving individuals and families impacted by osteosarcoma, a type of bone cancer that usually afflicts children, but in rare cases can also afflict adults, as was the case for Ann. Her journey, I think you'll agree, speaks volumes about what we like to call the mechanics of purpose and service-driven resilience. So, Ann, I want to start by providing some context for the amazing advocacy that you do. And to that end, we need to talk about the adversity that you've been through and the journey that you have been on for more than a decade now. For you, this all started with some knee pain when you were back in your early 40s. Can you pick up the story from there?
That's right. I was training for a marathon in 2010, and my leg kept hurting. And I had been a runner. I had been an athlete off and on after school. And so this wasn't new to me, going for a run, but what was new was the knee pain. So when it persisted, I went to the doctor, who said, listen, you're 43, your knee's going to hurt. If you're going to run like this, you're going to have some pain. Okay, fair enough, back out. And the pain was increasing. So went back to my sports medicine doctor, who said, you might need some orthotics. So I got some orthotics, and it worked. I mean, my feet felt better, but then going back to my podiatrist, I said, my knee still hurts. And he said, listen, my shingle says I fix feet, not knees. Fair enough. So 9 months of that sort of misdiagnosis merry-go-round later, I woke up one morning and could not weight bear. So I was on crutches at that point, crutched into my doctor's office and said, okay, it's time for an MRI. We've got to figure out what's going on here. And I met with some resistance from her, and I said, no, we're doing this.
You
today.
Wanted to know, you wanted to get to the bottom of it.
We got to figure this out, that I can't put weight on my foot, and I've had no injury per se. We need to figure this out. So I spent 3.5 hours going in and out of the MRI machine, and lots of experts coming in and dyes going in and all this craziness. And they came out and they said, we're not sure what this is, but we're going to need you to see an expert. So they only diagnose this type of cancer with a bone biopsy, which they take under general surgery. So when I woke up post-surgery, my surgeon was standing next to me and my husband was standing next to me, and the surgeon said, "And you have osteosarcoma."
So what were you told at that juncture about osteosarcoma, but also about your own prognosis?
So once the surgeon and the pathologist determine this is indeed what we're looking at, then you get sent to the treating physician, the hematology oncology doctor. To my surprise, my hematology oncology doctor was located in the pediatric center at Sloan Kettering. And so I was there with my husband, and we were looking around going, my gosh, it's so big. Do this many kids get cancer? Like, we just don't understand that this many kids get cancer. It's, pediatric cancer is considered rare. So that was confusing. And then met my pediatric oncologist, and I remember him very clearly what he said. He said, so we're looking at osteosarcoma. Here's what you need to know. You're going to go through 40 rounds of highly toxic chemotherapies. You will likely have blood transfusions. You'll be disabled. You will not be able to work. you will not be able to walk. You'll be in a wheelchair. You should make arrangements to leave your job now. You should probably go on disability. Like, did not paint a pretty picture at all. And then he held up a chart that said, here's your treatment plan. And it was a line graph. And, here's where you start, here's the end, and somewhere around here, and it was around just past the midpoint of treatment, he said, we're going to have to determine whether the chemo is killing you faster or the cancer is killing you faster. Most people don't make it to the end of treatment because the chemo is so highly toxic that you're not able to complete it. So that was my official introduction to my disease. And
that's a pretty sobering introduction.
It really was. But at the same time, I was mentally obstinate. I was thinking, you don't know me. I love my job. I love my family. I don't want to go on disability. Like, I enjoy my work. So this is who you don't know me. A couple of chemotherapies and I couldn't lift my head off the pillow. So that was neither here nor there. What I loved, it wasn't going to be the same anymore.
And I have a question before we move forward with osteosarcoma diagnoses. You said it's rare for an adult to get this diagnosis. How rare is it? Do you have any kind of perspective you can give us on that?
It's extremely rare. He told me, I asked the question because clearly this was an unusual situation that a 43-year-old was being treated in a pediatric cancer center. So we asked the question, how rare is it? And he said, there aren't really great numbers around adults getting osteosarcoma, but for your age range, it's somewhere around 0.001%.
Wow. So we're talking very rare. Talk a little bit about what you came to find about the children around you.
So I really wasn't sure how I felt about being treated in pediatrics. Just being in this space was sad, and it was empty. But by the way, when I went for that your diagnosis talk, and this is what your treatment's going to be like talk, the pediatric cancer center was empty. So it felt profoundly sad to be in a space where kids are very, very sick. When I started treatment in the pediatric cancer center was filled, the opposite was true. There weren't kids kind of moping around or, heads down, or they were very sick, but they were also riding the halls on their IV poles, and the nurses were dressed up as Jessie the yodeling cowgirl and an astronaut, and the hospital really attempted to create an atmosphere of cheer in a space where hope is a distant feeling often. So what I wasn't prepared for was the courage, fortitude, and truly grace that the kids who are suffering so greatly have. And what I didn't understand at the outset that I understand now is, when you see kids who have cancer and they're dancing and they're smiling and they're doing kid things, coloring or having a conversation, it's not because they feel okay. It's because whatever they're facing in that moment is so profoundly difficult. They don't want the people who love them the most to feel their pain. So kids will do anything to not be in that space of laying down in a bed and looking up at the face of their mother or the people that love them and seeing the pain that they're causing them. So they do everything they can to prevent that from happening, to show I'm okay, to show it's okay, we're going to get through this. The kids have incredible strength and fortitude and grace in protecting how the people around them feel.
I can only imagine, Anne, that was quite motivating for you as an adult, watching them as you're going through your own challenges with this treatment.
There was a fair bit of personal shame that happened in this space. So typically my nurse would come in and access my port to start chemotherapy in the morning. And when she would come in, I would just instinctively cover my port and like kind of pull back my shoulders so that, in some way it was harder for her to get to my port, but obviously I'm there to have my port access. So what am I even doing? Anyway, so that was just my instinctual thing, cover your port and protect yourself from the pain. But one day I was waiting to see my pediatric oncologist. I'm in the waiting room and there's a boy, and I'd become friends with this little boy. His name was Frankie, and he was 8 years old. He was in the waiting room and he's playing a video game in the waiting room. We have the same nurse, Louise. Louise comes and says, with her IV pole, the needles, the whole thing, and says, "Hey, Frankie, ready to get started?" Frankie barely misses a beat from his video game. He turns toward Louise, pulls his shirt up, and pushes his port forward so that she can access it easier. And in that moment, I was like, oh my gosh. And that's how you do it, ladies and gentlemen. Like, that's how you do it. Like Frankie, the 8-year-old boy who is about to have his port accessed with a long needle going into his chest, it makes it easy for the nurse to get her job done, while 43-year-old me is shying away and covering it up and making it difficult. There were moments like that all the time.
Well, there's a great metaphor right there. I mean, he literally leaned into the challenge.
Yes.
Wow. And at what point did you decide, I'm going to do something for this community? I'm going to do something for these kids. Did that happen while you were undergoing your own treatment?
Yeah, in really small ways. First, you're so sick, often, unlike the kids, like I'd be in a wheelchair for much of my treatment and throwing up. And my doctor would say regularly, if we could just get you to stop throwing up, Ann, that'd be super. It's like, they take it down on the chemo and maybe we could stop throwing up. My husband would roll me in and I'd have an emesis basin in my head down because like any light, it was just, it was bad. But on the days that I felt better, I remember, I had a floral and event design company, and we had these really cool, like little flashing cubes things. And like, I'd bring those cubes in and you'd push a button and they'd flash different levels. I remember bringing in a bunch of those cubes for like the smaller patients who would just be crying and couldn't be distracted. This is before iPads, by the way. So I'd bring those in, and that would like stop them from crying because it would sort of distract their mind. About halfway through my treatment, iPads came out, and noise canceling headphones were a real gift to me, because while you're in treatment in the pediatric cancer center, you're surrounded by crying kids, crying babies. There's a lot of noise, and you just want to shut your eyes and shut it all out. So noise canceling headphones were big. And then I remember like going to get labs, which are painful as well, and giving my iPad to a girl. And so I had uploaded onto my or downloaded onto my iPad, Dora the Explorer game, or like this little driving game. And when a kid was crying, I'd just hand them my iPad, and it was brand new. It had just come out. And that was very distracting. So I remember very specifically saying, if I make it out of here alive, I'm going to make sure kids have iPads and noise canceling headphones, because it was a game changer for me. And I could see the difference that it made when I would hand my iPad over to somebody.
At this juncture, Ann, because we're about to talk about what you've done with your advocacy, could you have imagined then in the hospital that you would go on to work with people and create this thing that became MIB Agents, Make It Better Agents?
There was another moment that's relevant to this question, and it was right around that time of the dark night of the soul and my mouth sores and my leg surgery. And I asked my doctor, what happens if this first line treatment doesn't work? And he goes, oh, it has to work. And I go, well, what does that mean? What do we do? What's the next thing? And he said, there isn't a next thing. This is it.
That puts it all in perspective, doesn't it?
There's a possibility, there's clinical trials. And I said, do any of those work? And he said, hit or miss, kind of a not yet was essentially his answer. And I remember going back to my room. I was in his office at that point, went back to my hospital room, the pediatric day hospital. And I remember going, okay, God, if I make it out of here, use me, like use my life. And it wasn't a bargain. It wasn't about bargaining. It was just, I knew that my life had changed in the time that I was in treatment, and I just wanted to be used to make it better. And so thus the name, we have to make this better.
Make it better.
Make it better.
Well, let's talk about Make It Better, because what you have created is just phenomenal. It's a nonprofit organization called Make It Better Agents, MIB Agents, kind of a superpower theme to this whole thing. How did that come to be? And then walk us through the highlights, if you will, of the evolution of MIB Agents.
So the superhero thing was just a natural thing. I didn't even really have to think about it. And that's because being around the kids who are undergoing this treatment, it's like a superhero where they're going through something extraordinary that was likely not of their choosing. They were bitten by a spider, like Spider-Man was bitten by a spider, and that's how he got his powers. Or, the superheroes usually come by their powers in an extraordinary way that is not of their choosing. So it is with kids who are facing cancer. The other thing that superheroes have in common is that they have to dig deep to find a way forward. And that's what these kids do. And as I had that silly thing where I'd bring those little light cubes and try to distract kids. But this is something that happens every day in the Pediatric Cancer Center. Kids are helping the other kids. They all the time. And they are suffering greatly, but they have great compassion for the other kids who are suffering. And superheroes do this. They swoop in and they try to make it better for other people, whether or not they are themselves suffering. They still move forward. They still dig deep, and they find this superpower within, and they have to do that, and they do it. So that was the impetus for like the logo, which is the superhero, and the superhero that in our logo is kind of neutral, because it's the superhero is all of us. And I think everybody's superpower is of course different, but at the core of it is when we know better, we do better. And so that's how that part started.
And before I forget to circle back to this, and forgive me for interrupting with this, but as you know, so much of our A2A philosophy is about this notion that we help ourselves by helping others. And when you talk about those kids being so compassionate for one another and helping each other out on the ward there as they're getting their own treatment, did you get a sense that that was part of their own motivation, part of their own drive to get better as well?
It helps. It helps you get better, and by being better and by serving one another. And today I have this example every single day at MIB Agents with our junior advisory board. These are kids who are in treatment, who have survived, who are siblings of kids who have passed from osteosarcoma. And they are the most extraordinary human beings that you might ever meet. Their whole thing is, how do we make it better? It's a constant theme of how do we make it better. So that I think all from anybody who's suffered greatly, you come out of it with compassion.
Tell us a little bit more about MIB Agents today. What are some of the programs that you have? What are some of the missions that you are looking to accomplish with your superheroes? What do you want us to know about MIB Agents?
So our goal, our mission is in our mission statement, and it's simply to make it better for kids with osteosarcoma. We do this in 3 ways. We have programs of support for kids and families who are in treatment for osteosarcoma. We have 8 specific programs for that. We have scientific programs that also come under our support or our programs banner. We have educational programs and resources for doctors, researchers, and patients and patient families. And we fund meaningful osteosarcoma specific research. Even if we don't fund a specific type of research, we share that research that other people have funded, because we know that when you know better, you do better. So when you know that there's a clinical trial that might be helpful, when you know there's a piece of research that might help another researcher, that might help a child in treatment, it has to be shared.
Now I want to talk about what you personally, Ann Graham, get out of this work that you're doing. We talk a lot about the power of purpose and service. We talk about helping ourselves by helping others. I know a couple of things about you from our conversations. One, you still have ongoing health challenges that can present challenges in your day-to-day life. And 2, you work really, really hard on this project. Why? What is motivating you to do this, and what are you getting out of it yourself? Because this is such an important thing for us to convey to other people who are thinking about stepping into advocacy.
The first thing I think you have to know is it's like being a parent, where it's a hard job. This is a difficult job to do. There's a lot you're around people who are suffering greatly on many levels and at different stages. It's hard. I attend too many funerals for children. Like, that is soul crushing in a way that you can't even put it into words, because no words rise to the moment of conveying understanding of what that's like to watch a parent attend their child's funeral. It's really difficult work. It's also really meaningful and impactful and powerful work. And it's work that needs to be done.
And I want to wrap up, Ann, by speaking directly to somebody who might be watching right now, who is thinking, gosh, what a remarkable story, and I'm sure that they're thinking that. But beyond that, I couldn't do that. I couldn't make a difference. I'm just one person. I can't do this. I don't have it in me. As somebody who was doing work completely outside of the world of advocacy, I assume never saw this as your life's calling. What do you say to that individual who's thinking perhaps he or she is not big enough for the occasion of stepping into an advocacy project such as this?
It's a calling. And if you're being called, you can do it. You can do it. And I say to people who ask this question, like, how did you do it? And I didn't go to school for this. I wasn't trained in this. I never worked in this field. It was a calling. And this particular disease is the oldest known cancer. It's been found in a 77 million year old dinosaur bone, and it's been found in mummies, and we have had no new treatments in 40 years. So the experts, in my opinion, have had the problem long enough, and we still have kids dying from this disease and losing their limbs from this disease. I know we had to do better, and I didn't know how to do it, but I knew I had to start. And if you build it, they will come, to be cliche. And we have built an incredible team, an incredible community. And I don't do this alone. This is a community. This is a team effort. It's a team sport. You just, if you're called, answer the call, pick up the phone, man. We need you.
I'm so glad you answered that call, Ann, and what a difference you are making in this world. Your story is so inspiring. Thank you for taking some time to share it with us today.
Thank you. And thank you for the great work you do. It's everything. It's absolutely brilliant and much needed.
You've been watching A2A Conversations, a presentation of the nonprofit A2A Alliance. Guest views and opinions expressed in this production are those of the guests and do not necessarily reflect those of A2A, its advocates, advisors, or partners. To watch more of our A2A Conversations, please visit us online at a2aalliance.org.